near-death experiences and psychedelics. That's the topic of today's conversation. It's Halloween tomorrow, so I could like this is a more there's nothing more fitting than I guess this is a little darker. And yeah, before I get started, um I'm gonna tell you about the what we're gonna talk about today. So we're gonna first define the near-death experience. We're gonna look at Dr. Sabum. He's done extensive work on the near-death experience. Then the Penn Reynolds case. This was a single case, but it was very like eye-opening. It kind of like made a lot of people question materialism. And then exploration of spirituality. I want to get your views on what you think it is, like what is reality. And then counter arguments, because even though these may make you think there's more to life than just physical objects, there are counter arguments to the cases I will be presenting, and I want you guys to consider that. And why are people interested in near-death experiences? It's not all positive, but it's very interesting. And then we're gonna look at case studies I found on Reddit and some article where they just, they're gonna tell like their personal antidote, and they'll give you a better idea what the near-death experience is. And yeah, and then we're gonna find the connection between psychedelic experiences and the near-death experience, which is very weird, like how like the therapeutic like potential for both of them, they have similar outcomes and there's slight differences, but like it's very crazy how similar they are. Opportunities, if any of you are interested. A marketer, we just need people to make like the marketing stuff. You could use Canva. I pay for the Canva. And processes and system leads, that's something potentially that if any of you are interested in, you guys could apply.
What is that, the process?
So basically, the whole idea behind that is when I'm gone next semester, not next semester, in 2 semesters, summer 2025, and the new e-board comes in. A big problem me coming in was there was nothing set. There was something set, but I wanted to be an easy transition for the next e-board to come in and just like get the things rolling. I really had to put a lot of weight and a lot of effort to like get things going, and I want it to be easy for the next group of people coming. So that's what you'll be working with me to like design processes and systems, put them in place so the next e-board could continue this club. All right, so we're gonna start off with the first question. What is the near-death experience? Any ideas? Go on, Nicole.
Can you do the ego death?
Ego death. Elaborate on that, please. Like, what do you
Okay.
mean?
When you take psychedelics, honestly, I've never experienced this, so I don't know. But I could guess like when you take psychedelics and then you feel like a part of you is like dying.
Okay. Okay, so
I
your
don't know if
sense
you
of
know that
self
part.
is
Yes,
dying.
your sense of self is dying.
Right, and so that makes space for a new self, perhaps.
Yes.
Interesting. What about you, man?
So usually what's meant by near-death experience is actually like actual death and not just ego. But there is that kind of ego death through, the psychedelics that give you an almost, it's like, that's what you said, they're similar because in effect, that's what happens because.
I mean, I don't feel like, so in the few times I've taken psychedelics, I've never felt like I was close to death. That's not something I could say that's happened. I'm sure it's happened to other people where they felt like they were gonna die, but that's not something I personally.
What happens to higher doses?
Perhaps, yeah.
I think I don't really like the term ego death, to be honest. I think ego dissolution is a better term because it's like it feels like parts of your brain are like shutting down almost. And not so much like that you're dying, but like a part of you is dying, if that makes sense.
Right, so
But
dissolution
you
is
still
like,
have like something. I don't know.
right, I know, I get, that's a great distinction. It's like the distinction between like 1 to 0 to like 1 to like 50% perhaps, right? Am I getting that right now?
There was also a time where like DMT had like the exact same processing of your brain that death had, and they were questioning like whether or not like DMT and death, like is that like a almost not a death but basically a near-death experience.
It's interlinked.
Yeah, they had like your brain when you're dying and then your brain on DMT are very similar.
Oh,
Yeah.
interesting. I would definitely look into that. That's very interesting. And that's actually one of the counter arguments that we'll touch on that I didn't realize it, but that's potentially our explanation. I made a mistake here. I was making this quickly, so I apologize. But this is the definition of the near-death experience. It's the process of death in which you come close to death, but you don't actually die. Death isn't just like you're alive and dead. It's a process. Like most things in life, trees don't just come out the ground. There's a process that happens. And there's two types of experiences people when they're in that process of going to like die. There's two type of experiences of people who survive it, claim to have had. And this was defined by Dr. Saibam. The transcendental experience where you go through your memories, you visit God, you see something mystical, you have a spiritual experience, and then you come back. And then the other one, the autoscopic experience, where in a sense your spirit leaves your body, for lack of a better term, but your spirit leaves your body and you're able to, for a temporary time, explore your world. And some people claim that they see what's happening. So like people are operating, giving them surgery or like CPR, and they see the whole thing happen. And that's what was interesting to Dr. Sabam. He wanted to see if that's actually the case. If we document so everything that's happening in the room, and then we ask them questions like survivors, do what they say and what happened in the room, do they align?
Like astral projection.
It's kind of like astral projection, but can you tell me more about it? Like I have a rough idea what it is, but like it's when you're sleeping, right? And then you get to explore the world.
Well, you can do it sleeping or you can do it consciously.
Okay.
And then, so spiritually, they say that we have a cord connecting us to our spirit, our
Right.
soul. So technically, basically, when you are astral projecting, your soul leaves your body, but you're still connected to your body with this cord. And then you can travel anywhere, really. And Buddhists do this a lot, like monks, or just people that meditate, or just normal people do it on accident too.
Perhaps it
But you
is.
can really go anywhere, and then you just come back to your body. It's kind of like, you ever seen Insidious? It's like Insidious.
Is that a horror movie?
Yeah, but it's about
It's
that.
very similar.
Yeah, no, it literally touches really good on astral projection.
Wonderful, yeah. So that is very similar to what the autoscopic experience is. You leave your body and you're able to explore the physical realm, but not in your physical body. So Dr. Sabam, who is this guy? He's a cardiologist, a doctor. And so he documented all his work in this book called Recollections of Death, which was reviewed and received positively by the New England Journal of Medicine. They're one of the top journals for psychiatry. And what he did, it was mostly his own patients, but he did have some people refer some patients, and he would address them differently. So he would do his normal job as a doctor, as a cardiologist. And what would happen is some of them would get close to death, but survive. And in that case, he would ask them maybe a couple weeks later, hey, did something happen when you were in that state of unconsciousness? Did you happen to experience anything? He tried to keep it as vague as possible. And to his surprise, a lot of people said they had either the transcendental experience or the one he was more interested in, the autoscopic experience, where they temporarily left their body. And out of the hundreds of cases where he interviewed, only 6 of them really convinced him that like, wow, perhaps this is real. And it made him question a lot of things that he understood about everything is mechanistic, like cause and effect. And there's no like, to him at least, there's no satisfactory answer to like, how is it possible that these people were near death, but they were able to describe the room, what surgery they were doing, this like their eyes were taped up, and describe what was happening to them in that unconscious state, and like tell details like the type of scissors they were using, like what fold, like what the lady was wearing on her watch. So that's kind of interesting. And this wasn't his patient, but it happened around the same time. So he was doing most of his work in the 1980s. This happened, I think, in the early 2000s. So it wasn't his patients, but Pam Reynolds, we could watch this video, honestly. I'll read this quickly. Every vital sign and most clinical signs of life and death was being monitored at the time. During her operation, her neurosurgeon, Dr. Robert Speltzer, hopefully I didn't say that name wrong, declared her clinically dead. Despite this, she was able to recount her experience while she was having surgery. And if you see here, that's a video of her. You can't really see, it's not the best picture, but her eyes are taped up. She had earplugs in her ear that were making ticking noises, and there's grapes layers of drapes covering her. So there's no way with her senses she was able to like recount what's happening. She was able to describe what was the surgeons were doing to her. And she got into that surgery room. Like she just woke up and because she got in this emergency surgery operation like unexpectedly. She wasn't expected to go into the surgery. So it's very like what's happening here? So we'll watch this video quickly, not the full video. So thank you.
When we return, how can Pam describe with startling accuracy the details of her own brain surgery? So 44-year-old composer from the Atlanta area has an incredible story to tell. While undergoing brain surgery, she says she left her body and actually watched her own operation. She describes the procedure in such vivid detail that it seems to defy scientific explanation.
When I came out of the body, there was no pain, no worry, no care. I looked down at my body. I knew it was my body. I didn't like looking at the body. That bothered me. But it was a wonderful, wonderful feeling to be free of it.
In 1991, Pam is diagnosed with an aneurysm, an enlarged blood vessel in her brain that's threatening to burst.
I had excruciating headaches. I went to my physician. He ordered a CAT scan, and they found the big aneurysm. I was beginning to leak, which is a sign of rupture. And had it ruptured, the outcome would have been certain death.
Because the aneurysm is deep within her brain, any surgery would be extremely dangerous. Pam's best chance for survival is an extraordinary procedure performed by Dr. Robert Spetzler of the Barrow Neurological Institute in Phoenix. As seen in this similar operation, Spetzler starts by cooling the body down to a point where he can actually stop the heart from beating. When you push it, Pam's extraordinary experience is just one of many cases where an experienced Dr. Michael Sabom, an Atlanta cardiologist, has compared the descriptions of 71 cardiac procedures by patients who reported out-of-body experiences with those who did not.
The people who said they watched their resuscitation from an out-of-body near-death experience gave me rather remarkably accurate visual pictures of what was going on in the room at the time that could later be documented as being accurate. I could find no other way that they would have known about it unless they had actually seen it from a point separated from the physical body.
But skeptics claim that even though patients are under anesthesia, they can unconsciously hear what is happening during surgery.
A lot of times in surgery, when you are under, you are not completely under. And this is a big problem for anesthesiologists. They have to make sure the guy is really under. Because a lot of people, they're lying there and they're aware of what's going on, but they can't say anything and they're terrified. So now if the person's not completely under, he hears this and then recalls it later as part of this near-death experience.
Of the surgical table, where she sees the doctors using a long-handled device.
It looked like my electric toothbrush, if you can imagine the handle on my electric toothbrush.
Well, this is what is called the Midas Rex drill, and it is pretty much what Pamela described. And it's sort of in a toothbrush form. It is a saw that's used routinely in neurosurgery, and it's not something that is visible as you're coming into the operating room.
The fact is, the saw is only removed from its sterilized container after Pam has been under anesthesia for more than an hour. Dr. Spetzler says there is no way she could have seen it before the surgery began, nor afterwards. But Pam's remarkable description doesn't stop there.
At one point, I heard a female voice distinctly say, "We have a problem. Her veins and arteries are too small." It was a female voice, and I believed at the time that it was a cardiologist's voice. And it turned out to be exactly that.
The cardiac surgeon is indeed a woman, Camilla Mikan, who did have a difficult time connecting blood vessels in Pam's leg to the heart machine. Pam says she had not met
You might be able to make a case for that during the first couple of minutes of induction, but not after that. After that, you are in a very deep anesthetic state. And in this particular case, you are in the deepest anesthetic state that's possible.
Not only that, during Pam Reynolds' operation, there is equipment used to help monitor brain function that is placed in her ears, which creates a loud clicking sound.
The evoked potential, which is the clicking in the ear, is a very, very robust signal. And then you've got to remember you're under multiple layers of drapes. I think it'd be impossible to hear a conversation.
Pam says that her near-death experience continues as she feels herself drawn away from the operating room towards a brilliant white light.
When I was out of the body, I had a distinct physical sensation of pulling from the
Alright,
abdominal
you guys get the
region
idea?
just above the belly button.
Wait, that's
And I
the
saw
whole
a tiny, tiny
Okay, so
little
it's talking about
pinpoint of light.
Mhm.
As if it were way
It's too
far
much
away,
favor,
just
it's felt
above the
the
belly
on the way.
sensation of pulling from the abdominal region just above the belly button. And I saw a tiny, tiny little pinpoint of light, as if it were way far away. And I went toward the light. And as I began to get closer and closer and closer, I started to discern my grandmother. I started to see her.
The transcendental experience. So if you had a mix of both, which is very interesting. But yeah, that's Pam Reynolds, the best documented non-near-death experience. All right, so based on what I just showed you guys, maybe nothing has changed, but what is your view of reality? Like, yeah, I want to get your input. Is this something you guys even think about? Like,
One of the best arguments towards non-materialism is the fact that we can go beyond what we see. Because the big thing is like, oh, empiricism, like our knowledge comes from the outside, but we've never seen a perfect circle. And yet we can just perfectly imagine what a perfect circle will look like. And like, well, all the perfect equations can match a perfect circle.
Mhm.
That's one of the biggest evidence we have towards what Plato called the forms. You know,
Yeah.
Plato forms,
Yeah, no.
right? And there's literally no perfect circle.
But yeah, we have these abstract ideas that like, where do they come from? I think perhaps an alternate explanation is that we are good at filling in the gaps, and a perfect circle is one of those gaps we like to fill in. So maybe, go ahead.
Reality.
I think about reality a lot. I have a lot of stuff. But
Yeah,
the first one that comes right now is, we're basically spirits in a material world,
okay.
you know, which is a Madonna song. It's so good.
You gotta
Because-
dance to Madonna.
Yeah, because like I believe that we all have a soul and spirit, and like we're just here having a human experience, but it's not everything,
Gotcha.
and then we go somewhere.
So there's like two worlds in your view, right? So there's the
Yeah.
spiritual world and the physical world,
Yeah,
the dualism. Okay, all right. Anything else?
I think one of the most interesting things is also like whatever changes we see to reality, it's always the same. You know, like the rain still rains, you know, the clouds still form, the sun still rises. We wake up in the morning. And even if you view it differently, it's still the same reality in a sense. It's crazy, right?
Yeah,
Yeah.
it's like when you read a book, we all can read it from our different point of views. It's all the same book, but we all,
They say the same damn book, right?
yeah, but we all like, we have all different interpretations, perspectives of the same thing. So yeah, same thing in reality. This is the ideas that I found online. Materialism, everything's physical, that you're able to explain it through cause and effect. Dualism, which Nicole looks like she subscribes to, sorta, is there's two worlds, the spirit world, the spiritual world, and the physical world. It's popular. I don't know if you guys know about Descartes. He's the first person to be like, put that forward. Maybe not the first person, but he popularized it. I'm not too sure about the history. Monism instead of dualism, everything's part of the same energy. That's an interesting view. And then there's pluralism, there's more than two, so there's spirit world, physical world, and perhaps a third, fourth, fifth source that we don't know about, and they're all interplay. And maybe there's a fifth option. I don't know. Is there a fifth option?
Empiricism, you know, the only reality is the one you see.
Okay,
Isn't
and
that-
wait, what's the difference between empiricism and materialism?
Well, you can see things that aren't material, right? It's like, um,
Air.
Well, empiricism is, if I remember correctly, I forgot the guy, but basically you observe the world and then you make conclusions from them.
yeah, I guess it's like that materialism is a consequence of empiricism. It's one of
Yeah,
the
exactly,
right, it's
exactly.
one of the possible routes you lead into, but it's also Quine says that God is part of empiricism. Because
Right.
if God fits our theories, if God fits the reality, like this, for example.
Right.
You can't explain that shit through material, right? So
Yeah.
whatever theory fits the evidence, that's the theory we follow. And
Okay.
that doesn't have to be material.
Got you. So it's like more of a philosophical, it's an approach to life, I guess.
Yeah, like reality.
Approach to looking at reality. Interesting. All right, so there's a counter arguments. The guy did briefly touch on it that like maybe the person, it's super rare, that under this case of anesthesia, you might still be aware. It's super rare, like less than 1%, but it's possible. Another counter argument is very interesting. How are you able to have memories if memories is a function of your brain? So like, how are these people being able to have this non-physical experience, store that non-physical experience in their physical brain? So I don't know. Let's go ahead.
Sorry.
No, don't
Really,
apologize.
Like,
Don't apologize.
I think a hypothesis for this could
Okay.
be that where everything's connected.
Okay.
So, in that point, she's still connected to her body.
Right.
And you already feel your soul. I mean, not everybody, but you can feel your soul when you're awake right now. So if you're still connected through this thread to your body, why wouldn't it still be connected? Like maybe if she had already like fully died, like went to wherever
Mhm.
they go and then claimed she came back, okay. But in this place, she said she could still see her body.
Yeah. Right. Yeah.
I mean, isn't our brain always functioning?
Yeah, but like this claim is she was above her body.
Yeah, but our brains still function, right?
Isn't it the last thing to die actually?
Huh?
Well, to like,
Yeah, I think the brain is the one of the last things to shut down, perhaps. I know vision's one, so what makes that even more interesting is out of all your senses, vision's one of the first things to shut down. And she was able to, she claimed she was visually seeing the world around her. So that's crazy.
the thing is, it would be really hard to prove like what my hypothesis.
Yeah, that's the thing about the whole dualism thing is like how does the non-physical interact with the physical? Like, and we're yet to see any evidence of that. Perhaps there is that I don't know of, but
If I'm not mistaken, I believe hearing is one of the last senses that go.
okay.
I
So
could be wrong, but
right.
heard that from somewhere.
Okay, I
It
get
might be a
that.
sense, but the actual part of your body, it might be your brain.
Oh,
Like,
okay.
Some people can visualize what they hear too.
Yeah. What's interesting about Pam Reynolds is she had the ticking noises going on, so it was like
Yeah, that's the
Yeah,
thing,
it could be
right?
like synesthesia, like the term for like when you hear something and it like produces visuals.
yeah, maybe. Yeah.
Well, you know what I'm talking about?
I think I know what you're talking about.
But that's more for like
Yeah.
shapes and colors, yeah. Not really like, it's not like you hear a ticking noise, you see the hose with the electric tube.
But it can,
Yeah.
no, like your vision can like bounce off the music. But like.
Yeah, because they overlap, but it's like,
Overlap, your senses can overlap.
but you wouldn't be able to explain how she saw with the toothbrush thing, like the hose.
I mean,
Through synesthesia.
you can, I mean, like, have you ever fallen asleep in class? Like, no,
Yeah.
stop. Have you ever fallen asleep in class?
Yes.
Yeah.
But have you like, do you go into like a deep sleep in class or do you like halfway awake in
Depends
class?
sometimes. Sometimes I'm like,
Yeah, okay, when you're halfway awake, right, you can kind of hear what's going around.
Yeah.
Have you ever been able to like be like, all right, this person next to me is tapping his pencil. This person next to me is doing this. This person over there is doing that. You essentially you can visualize that at some point, especially if you've already seen their faces. You can kind of visualize what they're doing. It's kind of like synesthesia. its own way.
So yeah,
More
that
like
is
echolocation. Okay.
echolocation, yeah, echolocation. So anesthesia awareness is one of the counts. I heard you touched on it. You kind of touched on it. Like you're sort of like still conscious, even though you're under this like anesthetic, you're still aware of your environment. And then another thing that it perhaps explained this is it's a survival tactic. She claimed she felt peaceful and felt calm, and the biological explanation, I guess, would be that it's to our advantage. So when you're in the process of dying, to feel a sense of peace, because if you start panicking, death is going to be worse. So it's going to reduce the feelings of death, and it makes you feel calm and like because a lot of people who experience this near-death experience, a lot of them, not all of them, but a lot of them claimed like it was very peaceful. And then, well, another one is perhaps she was in some type of sleep paralysis, dreamlike state, because there is some evidence that people who experience near-death experiences are also the same type of people who are more likely to like, while they're about to go to sleep or when they wake up, have symptoms of REM sleep. The REM sleep is the stage of sleep that's associated with dreaming. And those type of people, for whatever reason, that have this what do they call it? Sleep intrusions. So like when you're waking up or about to sleep, you're getting symptoms of REM sleep. So like your body, because when REM sleep, your body shuts down. Because like you're dreaming, you don't like in a dream when if you kick a soccer ball, you don't want to real like kick your leg because that would interrupt your sleep. So part of REM sleep is your body shuts down. You're a little paralyzed, and other things. And people who have that also tend to have more near-death experiences, are more likely to have. And perhaps it's just a function of our brain that we don't understand yet. So that's another perhaps.
Well, I think that's kind of confusing near-death experience with out-of-body experiences, because like you can have like a lot of times lucid dreams happen through sleep paralysis. So that's just like when you're aware of your dreams. So it can be like an out-of-body experience, but not necessarily like a near-death experience. If that makes sense.
Wait, say that again. So
Yeah.
there's a real connection. Yeah, they're very similar.
Well, I don't think they're actually that similar, because like I feel like it's out-of-body experiences are common like through like sleep or psychedelics or like it's very common to have out-of-body experiences, but near-death experiences is like when you like
you're about to die and you survive.
exactly, or like when you're like maybe like your heart stops beating and like but then they're able to recover it.
Yes.
The experience you had then and you're like clinically dead.
Yes.
It's like not the same thing as like
It's definitely not the same, but for whatever reason, those people are more likely, just because you're close to death. So back to Dr. Sabin, he had a bunch of patients that like had a near-death experience, but there was also a good amount of them that said like, I don't remember anything that happened. Like I didn't have a near-death experience. Like I technically did. I survived death, but they didn't have an autoscopic experience like the spirit thing or a transcendent. I can't speak, but transcendental experience. So
yeah, I feel like also it's like when you wake up, like how many times can you remember your dreams? You'll remember it for a couple of
right,
seconds.
yeah,
Maybe
yes.
it's the same thing. They'll remember
Exactly.
your
That is very
near-death experiences for a couple of minutes and then it will fade away.
yes.
It's very sad.
Yeah, imagine experiencing that and you're like, wait.
You
It
don't
goes
remember.
away. It's like what happened?
You don't remember, yeah, just like
Yeah.
but yeah. There's something like we average like 5-6 dreams or maybe more or less. I don't know, but we average more than 3 dreams, like just this random number. But we dream a lot, but we only remember our last dreams most of the cases. So when you remember your dream, you're only remembering the last dream you had. So why are people interested in the near-death experience? Well, people who have had this experience report strengthened sense of purpose. They know, like after they come and survive, they're like, I feel safe. Like they just know what to do and they feel more confident in their purpose in life. They have a deeper appreciation of life. They improve relationships. They tend to show more love, empathy to others, and they have a reduced fear of death. Their anxiety goes down. They're not as worried about death. But it's not all positive. There's a recent study, 2019, that they looked at 123 that had a near-death experience, and they did mention that this number might be higher. I mean, 14% classified as having a negative experience. And they also claim that perhaps the number is under reported. So maybe it's higher than 14%. So now we went over that, we kind of know what the near-death experience is. We'll go into case studies. This is from Reddit, because this is where people share their thoughts. So this guy, his username was why serve one, I don't know, nuts. So the quote is, so I had a near-death experience, no post, mercy flight en
Oh,
route.
why everyone?
Wow, there we go. See, that's good. Why is everyone nuts? So I had a near-death experience, no post, mercy flights en route. I saw and heard everything. I saw my daughter screaming, the respondents yelling, no post, the bystanders around me. I felt calm. I remember thinking, oh, this is what death feels like. This is what it feels like to die. I saw myself on the ground. My view was above. As someone who majored in cognitive neuroscience, I'll simply say that I personally believe we don't know enough about consciousness. We think we do, but we do not. We don't. And then this is an even longer one, same thread, Irish Spice. I'm not gonna, do you want me to read this all or you guys?
No.
No? Okay. I think the most cool thing is, you guys could read it, but
You'll send the slide after.
yeah, I could do that, yeah. The last part, she said she never saw him again. She also was no longer afraid of death. So in both of them, they both reported like being calm and the reduced fear, like the what I touched on before, why people are interested in this experience. Do you guys, I feel like some of you,
Yeah, I was reading the why are Christians going to be surprised?
yeah,
Oh, cause like, I think like out of body experiences go against like mainstream religions.
I don't know if Christians, well,
so what's,
Christians believe in heaven.
yeah,
Yeah.
so what's interesting about this is Dr. Sabum, he's a Christian himself. And he mentioned this is not proof of heaven or the afterlife, but it is consistent with an afterlife.
Yeah.
And so for him, it strengthens his belief in the Christian word. And another thing to consider is like the near-death experience is very much mediated by your cultural, spiritual understanding of the world. So that could perhaps change how you interpret it. This is from the article. Yeah, I'm not gonna read all that, but you guys can read it later. So now we're gonna talk about like its relationship with psychedelics. There's 3 studies I found. There's probably more, but like this is what I was able to find. In 2018, Timmer, Marshall, and colleagues conducted a study where 13 volunteers received a DMT intravenously in a lab, which basically means they got DMT injected into them. And
Smoking not enough.
no, so the reason, so yeah, so the reason straight in the veins. So there is a good rationale for it. There's a good rationale. It's not as crazy. Initially, in face value, that sounds crazy because we always think of needles as a bad thing. But in the clinical setting, it makes the most sense because when you inhale something, the dosage is very inconsistent. Like everyone could smoke the same amount, but we all inhale it differently, if that makes sense. So in science, you want consistency and be able to replicate your studies. And if you inject it, you know exactly how much is going into their system. And that's why they prefer this method. And that's probably where we're going forward. Like most of the psychedelic studies are going to be injected into you, if you are part of the studies. And then they compared, so the 13 volunteers, then they compared it from their big sample size, because this lady, she studies, her name is Marshall, studies near-death experience, and she had been collecting data since 2015. And the overlap they found is, it's a small sample size, so take it with a grain of salt. Both groups described entering an otherworldly realm, feeling separated from their bodies, meeting mystical beings, seeing a bright light, feeling peace, unity, and joy. But the one difference is the near-death group more often described encountering a boundary marking a point of no return. So that was, I don't really know what that means. What do you guys like? What do you guys think?
Like, would by point of no return doesn't mean like there's no coming back? Cause I feel like when like tripping, I feel like that can happen, like where people
Okay.
think, oh, they're gonna be stuck with that forever.
Right.
You know? So I don't know what that means, like the point of no return.
Exactly. I was a little confused when I read that.
I think it means like what people call is it? I don't remember it. The light.
When it's the light. Oh, okay, perhaps, yeah.
Yeah, because the background and the woman in the
Cam
red,
Reynolds, yeah.
yeah, she mentioned that she saw the light, she got close to it, but she didn't actually go to it, and when she was getting closer to it, she like came back to her body. So I feel like that's the no point in return.
Mm.
Because from what I've seen, I haven't heard of people actually going to LA and like coming back.
Right, yeah, it was very unique. And the near-death experience, that's like a characteristic that's unique to the near-death experience, based on this study. Another two studies in 2022, Ronald Griffiths, rest in peace, he recently died. And it's actually the journal club for next week is one of his studies as well. So you already saw that you already started making a summary. His team studied 3,192 people who had experienced a near-death experience, a psychedelic drug trip or mystical experience not caused by drugs. So they compared three type of experiences, and they found all three groups had remarkably similar long-term effects, one of them being less fear of death, positive changes from the insights they gained. And in another study in 2024, Marshall, so the same person that we just talked about, Timmerman and colleagues interviewed 31 people who had both near-death experience and had tried some type of psychedelic like LSD or DMT. And this is the difference that they found. The near-death experience had a stronger sensory effects, the feelings of disembodiment, whatever that means. Drug experience were tended to be more vivid in visuals. And then what was common between the two is they made them more like spiritual, find more meaning in life. And yeah, so the one thing that I find very hard in psychedelic science and like perhaps near-death science too, it's an emerging field as well, is it's hard to define these mystical experiences. For example, I just said stronger sensory effects like the feelings of being disembodied. What does that really mean? Like, do you guys have any ideas?
Maybe like separating from your body? Or?
Yeah, perhaps, yeah.
Hmm.
You feel a separateness from your physical body.
Maybe like, okay.
There you go.
I kind of felt like when I closed my eyes on the trip, I almost felt like I had no body. It was just, I felt like I was the outside.
Right.
Like I closed my eyes and I didn't really feel like I had a body, just kind of, I was everything.
Right. A oneness with everything. That is a common
That's monism, right? Like everything's like one. The one.
yes, the oneness. Feelings of oneness is very characteristic of psychedelics.
There's also like, it's weird because they bring up less fear of death. And that's something that's very like, that they were looking at psilocybin in elderly people, is that like, if you give psilocybin to elderly people, like they typically have a less fear of death based on like their responses
Mhm.
to survey. So take it as you take it.
This was that was by a study by Ronald Griffiths as well.
Yeah.
It was one of the first studies he did.
It was in John Hopkins. They did one in John Hopkins.
Yeah, Ronald Griffiths and John Hopkins. And it was on patients on their deathbeds.
Yeah.
They were about to die. They're like, oh, you have a year left to live or whatever. They were given a timeline. And Ronald Griffiths was like, let's give you guys like psilocybin. And they found the number one finding was that I think around 70 or 80% of them had reduced anxiety of death. They were like, oh, death doesn't sound too bad.
Probably help them so much.
Right, exactly. And so very interesting the connection these both have.
Okay, what was the science they said near death?
Experience on near-death experience science. It's a new thing that's there's a lot of studies coming out on it. That lady Marshalls, she seems like she's like doing a lot of study. Like she, if I remember correctly, she is working on doing the same thing Dr. Sabin did, where she would interview people. And so they have a near-death experience, and then they're heavily documenting the room, they're recording the room. And she's doing a study on that. Like she really wants to find out if Dr. Sabin was right or wrong. And then they're also introducing another variable of like random phrases are going to be said, and they're able to catch it. I'm not too sure, but it's very interesting, and she's trying to uncover if the spiritual like autoscopic experience is a real thing.
I saw like a scientist tried doing a study like that where he weighed the body of somebody that was alive and then,
Yeah, so
like minutes or hours after they were dead, and they did notice a little loss of weight.
it was like a pound of weight or something like that was lost. It was something very minuscule.
When they're about to die?
When they were dead. Like before they died and after they died, they weighed less after they died. Which typically it's weird because like when you go to sleep, you weigh more than what you do when you're awake.
So-
Because your muscles are like keeping you awake. And so when you die, you should be like way more heavy, and they found like a loss of weight.
Which
Mm.
is their, like, is it their,
The
Yeah.
theory, yeah,
that was a soul. Maybe.
yes, yeah. That's where my mind went
Soul
to.
weight.
The soul weighs 1 pound. What?
Yeah, but it wasn't like, it was like less than 1 pound. I just gave it.
Maybe it's just like the fluids in your brain drying up, I don't know.
Could be
But
air.
no, it was like right
Things.
after his death, though.
Like,
Like,
Immediately after?
it was like within 10 minutes. They
They
said.
need to do more studies on that, like, they need to
Yeah.
wait people
Yeah.
before they die and right
So
after.
many, like, scientists are skeptical, you know, as they should be, that's how they
Yeah.
find things, so, like, that guy, I was like, oh, it could have been just. her
Anesthesia,
hallucinating stuff.
yeah.
But if you look further into it, like, if you weren't as skeptical and you put a little spiritualism into it, like. Maybe it could be right, I mean, you can't really prove spirituality, so.
We also can't prove materialism.
You can't prove anything.
Well, you can.
You can't prove anything.